Welcome back to the Dr. Vincent Buscemi podcast, the Jaw-Body Connection. I'm going to explain today why people think oral appliances are scams when it comes to sleep apnea, why sometimes it's a last resort, and why sometimes your oral appliance therapy doesn't work, and what are things you can do to make it work. And remember, everything I say today is for purely entertainment purposes only. My only goal is to make you laugh, make you cry, have a good time. There's no medical or dental advice given. I'm a licensed dentist, but there's no medical or dental advice given. Look at this article. Upper airway collapsibility and loop gain predict the response to oral appliance therapy in patients with obstructive sleep apnea. I'm going to dive into why you can be CPAP intolerant. Your physician tells you you're probably a good candidate to go to your dentist and get some oral appliance. You can get an oral appliance from your dentist that can improve the obstruction in your sleep apnea and still have no improvement to sleep apnea. Or there's also another article right here, why surgical algorithms for obstructive sleep apnea update, why you can have mandibular advancement to surgery or maxillary expansion surgery or bring both jaws forward type surgery, why you can get a improvement in obstruction in your airway and still no improvement in sleep apnea. And it all has to do with something called loop gain. And I'm going to show you at the end of the podcast how there's a possibility to improve loop gain, which in this circumstance would be to reduce loop gain, and how you can get better results with your sleep apnea when your dentist gives you an oral appliance. And remember, this is for entertainment purposes only, not even education, entertainment purposes. Okay, why loop gain matters and why your oral appliance might not be enough with Dr. Vincent Buscemi. Okay. Sleep apnea oral appliance therapy often fails. Even when your dentist is super smart and the oral appliance fits perfect. But today I'm going to show you why something called loop gain may be the missing piece and how breathing retraining could help. Please seek out your physician or pulmonologist before you do any form of breathing techniques. However, from my own personal experience, I always feel much better when I do these breathing techniques. So we have to understand that sleep apnea has a mechanical part to it, which is airway obstruction, too big of a tongue, airway collapses, something is obstructing it, and a neurological or brain function that's causing you to wake up to. So what is loop gain? Loop gain is basically your body's response to carbon dioxide in your body. So high loop gain is you overreact to levels of carbon dioxide in your body. And even if you have a little bit high carbon dioxide, your brain overcompensates and causes you to breathe more, dumping off more CO2. And the less CO2 you have, the less your brain thinks yourself it has to breathe. So let's say you're sleeping and you have a little bit of change in CO2. That would be, and your brain overreacts to it. And you dump off a bunch of CO2. Your body needs levels of CO2 to tell your brain to keep breathing. And that could create an apneic event. So high loop gain means you overreact to high CO2, any level of CO2, which you don't want. Low loop gain means when there's different levels of CO2 in your body doesn't overreact and still calmly breathes with different levels of CO2. Why does this matter? Well, in the two articles I just showed you, they showed that when a patient has high loop gain, meaning a high overreactivity or a high sensitivity to levels of CO2 that even when the oral appliance therapy or the surgery removes the obstruction in obstructive sleep apnea, people still don't get resolution of symptoms of sleep apnea. So let's say I make you an oral appliance, a Start Thriving appliance. I do functional orthodontics, widen your arch, bring your mandible forward, open your maxilla, provide more room for your tongue, but you still have a high loop gain. The results you'll get, the improvement in your sleep apnea, will be much less than if you have a lower loop gain. And they found this in surgery too, that the biggest independent factor that shows if surgery or oral appliance will be effective is loop gain. So, in 2016, Edwards found right here, loop gain was a significant predictor of oral appliance therapy success. Loop gain was a significant predictor of the percentage reduction in AHI with oral appliance therapy. Those showing the greatest improvement had a low or normal loop gain. Even with a perfect anatomical fit, patients with high loop gain likely fail in therapy. I know what you're asking. Well, if high loop gain leads to poor results in oral appliance therapy or even surgery, how do I lower the loop gain? How do I raise my tolerance to carbon dioxide? We're going to get there. Here, surgery. Surgery reduces the airway collapsibility, but not loop gain. The impact of surgery on AHI is less in patients with increased loop gain. Loop gain remain unaltered despite significant reductions in AHI. What surgery does? Surgery is good. It opens up the airway. It improves the anatomy. It improves the ability for air to flow through your nose, into your windpipe, into your lung. I know that's not medical terms. Into your lungs without obstruction. However, surgery doesn't change loop gain. So even if you blow this tube wide open, but you still have high loop gain, you're not going to get the improvements from surgery or oral appliance that you need. Why doesn't surgery work for high loop gain? Because it fixes the physical component of it, but it doesn't fix the brain or the brain's response to carbon dioxide, because carbon dioxide sensitivity still remains high even after surgery. Now, this is the question I was asking when I read the article. Can we lower loop gain? Enter breathing retraining. Now, here's what you have to know from here to the rest of the PowerPoint. There's not great scientific evidence, controlled studies that show that breathing retraining, one of my favorites is the Buteyko method, can lower loop gain. But if we use a logical perspective on this, it seems like it does. So let's say you want to get stronger muscles or you want to run faster. It seems as if the heavier weight you lift with your muscles, the higher the stimulus, the more your muscles can withstand that weight and the stronger they become. So why can't the same form of logic apply to loop gain? Or why can't you expose yourself to higher levels of carbon dioxide naturally through breathing, and why can't that reduce your over response? The Buteyko method claims they can. I'm not a Buteyko master, I'm not a physician, but it totally makes sense that once you fix the anatomical variation, so you put an oral appliance in or you fix the pipe through surgery, I think you can use the Buteyko method to normalize your breathing patterns. So there is some research on this, but it is a hypothesis, and then the other research was on asthma. But look at this. Controlled hypoventilation may reset your chemoreflex thresholds, your chemoreflex thresholds, and reduce ventilatory instability and sleep apnea. That's a hypothesis, but it was written in 2011. In 2006, Buteyko training reduced hyperventilation and increased end-tidal CO2, suggesting chemosensitivity or sensitivity to carbon dioxide was decreased, because that's the whole goal. If you can tolerate higher CO2 levels, that will theoretically lead to lower loop gain, which will theoretically lead to more successful surgical outcomes and more successful oral appliance therapy. So if I expand your maxilla, decompress your joint, bring your mandible forward, make more room for your tongue, you also have to have a higher tolerance for CO2 to get any form of breathing improvement when you're sleeping. So you need to integrate oral appliance therapy with the Buteyko method. However, when I tell my patients this, you cannot start the Buteyko method until you consult with your physician. So this is on your own, but it is I don't want to say it's a must when you have oral appliance therapy through me, but I think this will vastly improve the benefits to your life, to the oral appliance therapy, if you start to implement the Buteyko method. So what are the key takeaways? Treating airway alone may not resolve sleep apnea. And you see this all the time. There's a surgeon, I think his name is Casey Lee, that thinks all oral appliance therapy is garbage. But he talks about these cases where he will blow the maxilla wide open up the airway, and then they have no improvement of quality of life. And he doesn't know what's going on. I think it has to do with loop gain. So here are all the scientific references I referenced today about loop gain, oral appliance therapy. But now that we have 2 minutes left on the podcast, I want to run through one Buteyko breathing exercise that I am starting to do daily that will increase your tolerance to carbon dioxide. Again, this is for entertainment purposes only. And this, please look up Buteyko breathing. I'm not certified at anything Buteyko, but I feel like this is easy to learn. What you want to do, what they call this, the core Buteyko breathing, is breathe in 2 seconds through your nose, breathe out 3 seconds out of your nose, and then plug your nose for 4 seconds. So let's try this together. Breathe in. Hold your breath. Oh no, start over. Breathe in 2 seconds. Breathe out 3 seconds. Hold your breath for 4 seconds. And then you want to plug your nose. So I'm going to do it without talking real quick. So it goes 2 seconds in, 3 seconds out, 4 seconds plug your nose. And do that for about 5 minutes. And in that time, that's one of the core breathing methods for the Buteyko method. You're training your body to tolerate levels of carbon dioxide, which theoretically lowers your loop gain, which theoretically will improve the results you get from oral appliance therapy. And all this breathing training is free. All right, guys, I really appreciate you guys listening. What I would do your homework, either go buy the book, The Oxygen Advantage by Peter McCohen, or start looking up Buteyko breathing methods and start doing it. Thanks, guys. Have a good weekend. Bye.